Mm, Hi there. I am Dr. Pranita, and today I'm going to be talking about the principles of drug prescription. So, this is an example of a prescription that we have here locally in our hospital called Hospital Queen Elizabeth in Kota Kinabalu, Sabah, in Malaysia. So, I'm just wondering, let's get our minds thinking what must be included in a prescription slip? For example, do we need the name? We probably need an ID number or the diagnosis, and of course the medications, and the doctor has to sign and chop, and not forgetting the hospital or the ward that this prescription is coming from, among other things. Now, there is a process of rational prescribing. There's 6 steps involved. The first one would be you define the patient's problems, and then comes the you would need to specify a therapeutic objective. For example, if the patient has URTI or upper respiratory tract infection, what would be your therapeutic objective in that sense? And then you would verify your P treatment or P drug based on the suitability to achieve your therapeutic objective, which is again aimed at step 1, defining the patient's problem. And then step 4, you would actually just start the treatment. And then you would also give information, instruction, warnings, potential side effects, and whatnot to the patient that's taking it. And last but not least, you would monitor the treatment, whereby if the therapeutic objective is achieved, the treatment may be stopped or continued. Now, this is example. You sit with, as a medical student, you sit with a general practitioner or a GP. Let's just say his name is Dr. Vic. And you observe the following case. Ahmed, a 52-year-old taxi driver, complains of sore throat and cough, which started 2 weeks earlier with a cold. He had stopped sneezing but still has cough, especially at night. This patient is a heavy smoker who often has been advised to stop. Now, upon further history taking and examination, it showed that examination of the systems were unremarkable apart from throat inflammation. So now you notice Dr. Vic advises him to stop smoking and writes a prescription for codeine 15 mg, 1 tablet 3 times a day for 3 days. Okay, so now based on the patient just now, his name was Ahmed Yusuf. He would have an ID number and a registration number to the hospital or clinic. His age is 52. The date, the current penyakit is the current disease, and he was prescribed codeine 50 mg, TDS 3 times a day. And this is still not a valid prescription, as it does not have a sign and an official chop of the doctor or the prescribing physician. Now, this would act as a valid document because it also has a number up here, 4808566, so we know where the prescription belongs to, and it's easily trackable in this sense. So now, what is the competency framework behind prescribing? First, the probability of benefit from the treatment. For example, if a patient has high BP or blood pressure, you would prescribe an antihypertensive to achieve a desired MAP. The second framework would be the probability of harm from the treatment that was prescribed. The patient that has high BP, an antihypertensive was given, which also carries risks. But the hypertensive emergencies risk are maybe more than withholding the treatment. So the third would be the probability of harm if you don't even use the treatment. So what happens in a case of hypertensive emergency, since the BP wasn't treated? Further end organ damage could happen. So now let's go into categories of medication. The first one would be general sales list, or GSL. These can be, just think of your everyday use vitamin C or your paracetamol. where you can buy it almost anywhere but in smaller quantities, is reasonably safe, and it can be bought just without a prescription, basically, with very few legal restrictions. Now, these two are very closely related. One is pharmacy medicines, also known as P medicine. The other one would be prescription only medicine. So, pharmacy medicine is something that you can buy over the counter. It could be for short term or long term use, but still does not need a prescription. Such as, imagine yourself walking into Guardian or Watson's or CVS in the United States. You would just go back where the pharmacy is seated, and you can just tell her that I'm having so and so kind of symptoms, what would be most beneficial for me, and then she would give you the medication and you would just purchase it. For example, like an analgesic, maybe you fell and you injured your knee. A paracetamol, which you could get from the GSL, isn't really working, so you would need something stronger. And then the third one would be prescription only medications, which is POM. This one, similar. It can be bought from Guardian Pharmacy or CVS, same at the back by the pharmacist, but this one you would need a doctor's prescription. So the similar prescription, you can still bring it to private pharmacies and buy that. For example, like insulin. Or some certain antibiotics may not be available at the primary healthcare center, so they require you to purchase it, but definitely needs a CHOP and a signature and an official stamp or CHOP. This one it would be called the POM, and without in the third one, the POM, without a prescription, they will not be able to dispense the drug. Another example would be insulin or antihypertensive drugs. Certain patients are usually given 1 month supply by primary healthcare centers. So in case they're not able to go for the next visit or appointment, they can use that prescription to get it for the time being from private pharmacies, if they have the prescription. Now the last one, controlled drugs. They are under the Dangerous Drug Act of 1952. This one definitely requires a prescription, and it's actually stored in a very controlled environment. Not everyone has access to it. The examples of these is codeine and morphine. So the three commonly misused substances is the opioids, depressants, and stimulants. And long-term use of this can result in morbidity and mortality. For example, the National Survey of Drug Use and Health in 2016 showed that over 10 million misused prescription for pain medications in the US, and 2 million misused sedatives, stimulants, and tranquilizers. This is an annual statistic, so it's a little bit worrying. And most of these people begin using this, for example, like morphine for like physical pain or like chronic pain such as cancer pain or things like fibromyalgia. Now, a very controversial, not really controversial, but something that we call the blockbuster drug. This is the famous Viagra, released by Pfizer more than 20 odd years ago. Now, why are they called a blockbuster drug? See, Pfizer's patent application process began in 1997 for Viagra, for the active ingredient in Viagra, and it was expired in 2017. Now, what happens when a patent expires? Within 3 months, within 3 months of the patent release in 1997, right? Viagra already earned more than 400 million, and with annual sales of almost up to $2 billion US, this is. So what happens after 20 years of earning such big money? Viagra itself produces a generic drug for its own initial creation of the little blue pill. Now it goes white, but they slashed the price. So now, why was Viagra a blockbuster hit? Simple, money. It generated millions, billions of dollars. Second, Why was there a race to replace post-patent expiration? Well, very simple. Because it's making money again. So obviously there would be the race, because when there's want and need, there is the demand and the production. Yeah. And the third one, can any pharmaceutical companies launch a generic version of this drug? Yep, any companies can, as long as they purchase purchase the active ingredient, since the patent has expired. Now, which brings me to, what's the difference between original or brand trade versus generic drugs? The active ingredient, like I said earlier, there's no difference, but there's significant difference in the price. For example, the original drug would be, say, 3 pluses versus the generic would be only 1 plus. Drugs often have inactive ingredients, such as stabilizers and whatnot. These differ drug to drug and country to country, so it's a little bit hard to compare. Dosages, there's no difference. Appearance, very different. Their size, color, packaging even changes. Now, when it comes to licensed or off-label prescription drugs, off-label, which is a medication that is used in a different way than to it being prescribed in the product list during the license obtaining. This is used in a range of illnesses. Okay, so now unlicensed drugs would be drugs that are licensed in a particular formulation based on the usage or the indication, but the similar drug is being changed into another formulation to suit a particular patient. For example, stroke patients that do have an absent gag reflex, you are required to give a tablet form of medication. You may not be able to give it as a tablet because the patient does have a no gag reflex, so sometimes we would pound it and give it via the nasogastric tube. Now, the use of unlicensed and off-label medications in Malaysia, a recent study showed that in pediatric ICUs, approximately 30% were unlicensed and 35% off-label use. And this is quite astonishing, as in the pediatric wards, we're usually very wary of using drugs off-label and unlicensed, so it is used a lot. So the conclusion was it is common even in pediatrics group of population. Now, every drug would have something called a product characteristic list, which would look something like this. It just basically has the basic information that is required for healthcare professionals, such as the therapeutic indications, its contraindications, specific warnings, or drug-drug interactions, drug-food interactions sometimes, whether there's an effect on fertility, pregnancy, and lactation, and what are some of the undesirable side effects. And other pharmacological properties would be the pharmacodynamics and kinetic properties, most definitely. And the preclinical safety data will usually be put in the product characteristics list. And other important things include shelf life, which is under the pharmaceutical particulars. That's also important because you wouldn't want to use or administer an expired drug to a patient. And these are the resources, and that's about it for today. Thank you for following me.